Let's begin with the surface features of the liver. This is the anterior view of the liver, and this is the posterior view. When one looks at the liver, as you see it on cross-sectional imaging such as CT and MRI, you can see that the lumen of the inferior vena cava is within your view. There is variation in how much the liver actually wraps around the inferior vena cava, or IVC. Sometimes the liver doesn't wrap around the vena cava, and sometimes it partially wraps around, and rarely the liver actually wraps all the way around the IVC. There is a vascular ligamentous structure that encircles the IVC when the liver does not completely wrap around it. This is referred to as the caudate ligament or the caval ligament. From a surgical techniques point of view, this ligament is divided first in order to enable exposure and control of the right hepatic vein outside the liver. This is a cephalad view of the liver, depicting the IVC as it emerges from the liver and traverses the diaphragm toward the heart. Holding the liver to the diaphragm are the coronary ligaments. These are actually peritoneal reflections, which include the left coronary ligament and the right coronary ligament. They are composed of an anterior layer and a posterior layer, and these two layers actually converge on each side of the liver to form the right triangular ligament and the left triangular ligament. The inferior or caudal extension of the anterior layers of the coronary ligaments forms the falciform ligament. The falciform ligament contains the round ligament, which is the remnant of the umbilical vein. This is a caudal view of the liver. In the same plane as the falciform ligament runs the umbilical fissure. The left portal vein actually travels or runs inside the umbilical fissure. The ligamentum venosum, which is a remnant of the sinus venosus, is situated in a groove that sits right between the left lateral sector and the caudate lobe, and it actually travels from the caudal aspect of the liver to the cephalad portion and terminates at the level of the left hepatic vein. Surface landmarks are useful to orient oneself to liver anatomy. The falciform ligament is often referred to as dividing the right lobe from the left lobe. This has to be differentiated from Contley's line, which actually runs from the gallbladder to the medial aspect of the IVC, thus separating the right hemiliver from the left hemiliver.